The Georgetown University Center for Excellence in Developmental Disabilities, GU-SED, presents the Transition Implementation Partnership, TIP, video series. The TIP video series was created to help parents with intellectual and developmental disabilities understand how to navigate systems in the District of Columbia. This video is made in partnership with local parents. Enjoy this video at your own pace. This video contains a lot of information and is meant to be paused when needed. You can watch the sections of the video that are most helpful to you. You can also ask someone else to watch this video with you for support. Thanks for watching. Healthcare Part 2: Understanding Specialty Care and Medical Emergencies.
Hi, my name is Ricardo, and I am a parent of a wonderful son. I have on today a beautiful yellow shirt. I have a dark color. I have gray hair, and I am here with my wonderful wife. What's your name?
Donna Thornton. My name is Donna Thornton, and I have a beautiful blouse, color blouse on, and blue pants. I worked 28 years, and I retired.
And you love it, and we are two proud parents and grandparents.
Yes.
Now we're here today to ask questions, and we hope this video will help other parents like us, right?
Yes. What is a health care specialist?
A specialist is a healthcare provider who has special knowledge and skills for a particular area of medicine. There are many types of specialists who take care of different parts of the body. Examples of specialists include cardiologists, who take care of any problems with the heart, psychologists, psychiatrists, or counselors who address your child's mental health needs, and otolaryngologists, also called ENT doctors, who treat your child's ears, nose, and throat. Summary: healthcare specialists have special knowledge about a particular area of medicine. Different specialists take care of different parts of the body.
How can I find a health care specialist?
Your child's PCP may recommend that your child see a specialist to help diagnose and treat a medical problem. In that case, your PCP may refer you to a particular provider. If you think your child needs to see a specialist, you can consult your child's PCP. The PCP may agree that your child should see a specialist and may provide the names of providers they recommend. Sometimes, the PCP will explain that they can provide the care your child needs. You can also ask someone you trust to help you find a specialist for your child. Many insurance plans require a referral from your PCP before you can see a specialist. If you have questions about whether your insurance will pay for a visit to a specialist, you can call your health insurance provider. You can ask someone you trust to help you call your health insurance provider and to help you call a specialist. If your child has a developmental delay or disability, your PCP may recommend that your child see additional types of healthcare providers, including occupational therapists who help your child to use their hands and eyes together to hold a pencil or crayons, tie their shoes, or hold spoons and forks to feed themselves. Speech-language therapists who can help your child use their voice and words to communicate with others, and physical therapists who can help your child use their large muscles to walk, run, go up and down stairs, and climb. Summary: your child's PCP may recommend that your child see a specialist for some medical problems. If you think your child needs to see a specialist, ask your child's PCP. You may need to get a referral from your child's PCP before your child visits a specialist. The PCP may recommend different types of therapy if your child has a developmental delay or disability.
If it's an emergency, what can I do?
If you think your child is having a health emergency, call 911. It is important to try and stay calm. Answer all the questions that the person on the phone asks. You may need to say exactly what is happening with your child. Give the address where the emergency is happening. Give the phone number that can be used to call you back. Share a brief medical history about your child. For example, you may be asked if your child has any health conditions, if they are taking medications, or if they have any allergies to medications. Summary: call 911 in a health emergency. Try to stay calm and answer the questions you are asked. Be prepared to share information about what is happening with your child, where the emergency is taking place, and a phone number where you can be reached.
What are my rights as a parent?
As a parent,
All parents have the right to participate in services, programs, and activities for themselves and their children. If you have trouble participating because of your disability, you have a right to ask for help. This help is called a reasonable accommodation. There are many types of accommodations. Some examples are getting help to fill out forms and having things explained to you in a way you understand. You can be provided with an assistive listening device if you are deaf or hard of hearing, or get documents in Braille or large print if you are blind or have low vision. You can ask the healthcare provider to break down medical information into small pieces to make it easier to understand. You can also ask the healthcare provider to explain any big words they may use about your child's health. As a parent in the healthcare system, you have other rights as well. You have the right to receive information in the language that you speak. You have the right to know any risks and benefits about the treatment recommended by the healthcare provider. Risks are if a treatment or medicine may cause harm to your child's health. Benefits are when a treatment or medicine can improve your child's health. If you are not satisfied with the suggested treatment plan, you have the right to get a second opinion from another healthcare provider. You have the right to the privacy of your child's information. What you share with the healthcare provider is confidential. Confidential means that your child's healthcare information is kept private between you and your healthcare provider. Your child's health information can only be given to others if you agree and sign a form. You may or may not choose to share your child's health information with others, like another doctor, family member, friend, or other supporter. No one can turn your child away from healthcare or treat your family unfairly because of who you are. Healthcare providers cannot discriminate against you or your child. Discriminate means to treat you or your child differently than others because of your disability, race, gender, religion, or sexual orientation. Summary: you have the right to participate in healthcare services for your child. You have the right to ask for reasonable accommodation, including having medical information provided in a way that you understand. You also have the right to know the risks and benefits of treatments recommended for your child. Have your child's information remain private and not be treated unfairly because of who you are. Regular checkups with healthcare providers can support your child's well-being. Checkups help with your child's healthcare needs as they grow. Teaching your child about the importance of caring for their overall health can support them throughout their life. This is the end of part 2 of the healthcare system video. You can review part or all of this video. If you would like to learn more about the healthcare system, view the part 1 video, Healthcare for My Child in the District of Columbia.
I'm still getting the chance to be a grandparent. I tell my kids, they call me grandpa, and I'm like, that's too old. Just call me Big T. That sounds better for me. And they call her Honey.
call me
Like
honey.
like the honeycomb.
I'm honey.
Honey. And that takes the G out, but I know for those who are becoming grandparents, it's a good thing. You're
Yes.
still in the teaching mode. You still can help them because they're going to need a lot of people to guide them through their
Yes.
growth.
This video was developed with funding from the U.S. Department of Health and Human Services, HHS, Administration for Community Living, ACL, Administration on Disability, AOD, Grant 90DDU C0086. The video content is solely the responsibility of the Georgetown University Center for Excellence in Developmental Disabilities, GU-SED, project staff and partners, and does not necessarily represent the official views of the HHS, ACL, and AOD.